I produced this short video in an attempt to allay the fears of those who have just been diagnosed or who may think that they have prostate cancer. Before I begin, make no mistake, only doctors can diagnose cancer. My video will not. 3 years ago, I was diagnosed with prostate cancer. Today, I am thankfully free of this terrible affliction. I would not have known about my condition but for a routine medical we called RMOT that my wife and I had periodically. There were no symptoms, save for visits to the toilet, that had always afflicted me. No pain, no blood, in fact nothing that gave me cause for concern. Yet, on this occasion, out of the blue, a blood test showed an above normal level of prostate-specific antigen, or PSA. My doctor referred me to the urology department of a local hospital. The urology consultant explained that the blood tests were only a guide and that a full trus biopsy would be required for a reliable diagnosis. The meeting was informal and informative, and at the end, arrangements were made for the said biopsy. The trus biopsy itself is uncomfortable but not painful. It involves lying on one side, knees bent, whilst the doctor manoeuvres a pencil-like instrument containing a spring-loaded needle along the anal canal until it is opposite the prostate gland. The activated needle penetrates the anal wall, entering the prostate gland, capturing a minute sample. The procedure is repeated several times on each side of the gland, avoiding the urethra. The biopsy results will indicate whether the cancer is low level or aggressive, jokingly referred to as a pussycat or a tiger. Once the results are known, a team of doctors and other medical staff will assess each case individually, and when completed, the individual patients will be called back to the urology department. My biopsy results introduced me to a new term, the Gleason score, derived from the pathologist's assessment of abnormal cells found in the biopsy. There are combined gradings that lead to a score between 2 and 10. 2 to 4 is low, 6 to 7 is average, and the highest is 8 to 10. My results were borderline average. At this point, all I wanted to know was, what should I do? But the consultant had other ideas. He told me that all options were open to me, including one called wait and see or active surveillance. This involved doing nothing but required regular checks for the duration. There were other options and their variants, including radiotherapy, keyhole surgery and radical surgery. However, the consultant would not recommend one procedure more than another. So I had to make the decision, and this seemed strange to me because how could I choose a particular procedure if I did not understand it? Low-level cancers may never develop, so it's possible that you could die of other causes rather than the cancer. I pondered on this for a day or so, not certain what to do. I read the information I had been given, but in the end, it was the conversation I had with a surgeon who persuaded me to have full radical surgery. Why, I hear you say? Well, for me there were 3 reasons. Firstly, the cancer would be physically removed. Secondly, there is a risk of cancerous cells getting into the lymphatic system, from which there is little chance of a cure. But lastly, and most importantly, the option takes away not just the cancer, but also the uncertainty and hence the worry. The operation takes a few hours and is complicated by the proliferation of nerve bundles in this area. My prostate was removed along with 2 lymph nodes. The urethra is cut, as are the nerve bundles around the penis. A catheter is inserted into the bladder and out through the penis, allowing urine to flow into an external bag and allowing the urethra to heal. The nerve bundles are also reconnected. There are side effects, the main one being that as the prostate produces seminal fluid, which is the carrier for sperm, it follows that if all the prostate is removed, there is no seminal fluid and ejaculation is therefore dry. How sexually active you are could obviously affect your choice of procedure. I was left with a 4-inch scar that was held together by metal clips that were removed later without any problem. My PSA level will be monitored for the rest of my life on a 3 or 4 month basis. I was hospitalised for about 5 days, although this may vary from patient to patient. I had to use a urine bag for about a month, after which the catheter was removed and urine then passes in the usual way. However, it took a week or so for the muscles to operate as before, so that in the interim period a towel is worn in case of small accidents. Finally, if invasive surgery is your choice, then it is imperative that you check carefully that the surgeon who operates upon you has a proven record of success. Otherwise, you risk additional side effects like incontinence and/or erectile dysfunction. It was my view on this matter that I did not want to be part of someone's learning curve. Having invasive surgery is a serious matter, but on balance I am happy with the results, and my bowels and bladder are operating normally. It is my hope that this short video will be helpful to you.